Peter, I look at Kentucky as just one example, I believe, that's really struggled with how to do this for poor people. What have you learned in 2 years?
Well, the exchange works much better now than it did the first year, both in the federal exchange and at the state exchange levels. And Kentucky actually is an example of a exchange that worked very well. It actually became a political football with Bevins' election a couple of days ago. But Kentucky's exchange is one of the few that worked well at the beginning to allow people who had subsidies under the Affordable Care Act to sign up. Maryland's exchange did very poorly. It's now doing very well. The federal exchange, as many people remember, did very poorly. It's now doing very well.
Guys look at you as the ultimate leftist MD, helping the poor with the basic idea that you're taking money from the taxpayers or whatever the stereotype is. Inform those that don't agree with you the benefit you've given to society.
Well, we run a co-op, a health insurance cooperative that is up against the big guys, the Blues, the Aetnas, the Uniteds, et cetera. And we've been providing great coverage to 25,000 members now, many of whom have subsidies through the Affordable Care Act that have kept people healthier and have actually decreased health care costs. For example, in our primary care offices that we run, we've decreased the unnecessary emergency room visits by over 10%, which saves the society money as well as keeps people healthier.
I believe we can count accurately emergency room visits as well. Where will you be and where will Obamacare be in 5 years?
Very good question. It obviously depends somewhat on the presidential election that's coming up this next year. If Hillary Clinton wins, I think the Affordable Care Act continues exactly as it is now. Maybe some tweaks if they allow the bill to be reopened. If a Republican wins, I think it's replace and repeal.
If you had a cup of coffee today with the new Republican governor of Kentucky, and what a rare event that is over 4 decades, what would you tell him to convince him to push against your critics?
I would absolutely encourage him to expand Medicaid to cover those who are uninsured, who are of low income, and I would encourage him strongly to continue the Kentucky Health Exchange, which has worked very well. And for a relatively poor state in Appalachia, in part in Appalachia, they have done remarkably well at getting their people covered. And when you have access to health care, you are more likely to have a healthy population, which will save you, Mr. Governor Bevins, in Kentucky.
Dr. Beilenson, what we love about you is you actually do medicine. Tell us about what you've learned with the Affordable Care Act and obstetrics. Are we having a healthier birth process for impoverished people in Baltimore?
I don't think that has not changed with the Affordable Care Act, because if you're pregnant, you're eligible for Medicaid before the Affordable Care Act. So there was actually decent access to affordable obstetric care before. So that is one area we have not seen a difference. We have seen a difference in getting people medicines that they need and controlling chronic conditions, because a big problem with health care costs in America is 5% of people cost 50% of the medical spend, and most of that is chronic diseases that were not well controlled. With the Affordable Care Act and more access to insurance, people are getting the medications they need, and so chronic conditions are being much better controlled, which saves money in the short run as well as the long run, and keeps people healthier and keeps them from tipping into negative consequences of their chronic condition.
Love to have you on. Dr. Beilenson, thank you so much. Peter Beilenson in Baltimore with the Evergreen Health Cooperative.